You're listening to the DVMA podcast.
Welcome back, everybody, to another episode of our podcast, and I'm so excited to be talking about communication. With me today, I have Dr. Jamie Morrisey and Dr. Jane Shaw, faculty at Colorado State University in the Veterinary Communication for Professional Excellence program. How are you both doing today?
Quite good. Thank you for asking.
Yeah.
Snow here in Colorado.
Yeah, doing great. No snow in upstate New York, right where I am right now, but gray and cloudy. Definitely feels like spring though.
A perfect day to be inside and talking about how to talk to people.
Exactly.
Well, thank you so much for joining us. I really can't express how grateful we are to have you on our podcast and to be talking to all of our listeners today.
Well, thank you for your interest.
Awesome. Yeah. And so I guess just to kind of kick it off, what do we mean when we're even talking about communication? I mean, it seems like a blanket statement. Everybody should know like what communication is, or I guess I should say common sense. But I feel like it's worth taking the time to really dive in. What do we mean? What are we talking about?
I'll let Jane take the lead on that.
So I think we can think about two kind of components of communication. The first is communication is sending a message as a basic starting point. And that message can be sent in a lot of different ways. That can be sent orally. It can be sent as a written message. It can be sent through your nonverbal behaviors. We can send it through a lot of different formats today, right? Like a text message, an email, a video. And we also communicate through social media and through websites. So all different types of ways to send messages today. And of course, we focus a lot on what makes that communication receptive to someone else. And so the second part is the listening of that message or reception to that message and how that person hears what we said, interprets what we said, and relates to how we shared it. And then the third piece is they then communicate back to us, and we have a sense of feedback of how well that message was received.
Yeah, I would agree. I mean, I think communication is really, at least in the context that we teach it, is all about the interaction that we have with our clients and our team, with the goal of allowing us to do the job of being a veterinarian to the best of our ability.
For sure. And I know, at CSC, we talk a lot about why it's so important. Could you give me or at least the listeners here, more information about like, how does communication allow us to be the best veterinarians, at least when it comes to our team or the hospital or the practice in general?
We know from studies both in veterinary medicine and human medicine that the way physicians communicate with patients and the way we as veterinarians communicate with clients has an impact on a lot of really important clinical outcomes. And we can think of that at multiple levels. So we can think about that as the practice as a whole. So the ability of that practice to stay physically successful, right? And to create a workplace culture in which it recruits and maintains employees. At the team level, which is how do we interact with each other? What is it like on a day-to-day basis to communicate within all the members of the team? And then at the individual, so what is it like for you as a veterinarian? Do you feel satisfied and fulfilled in your career based on your interactions with your colleagues and clients? And then at our client level, do our clients leave feeling satisfied? Are they willing to comply with our recommendations? And then at the patient level, if all of that flows all the way down to the four-legged animal, the patient actually get better as a result of our recommendations, and hopefully our recommendations turn into actions on the client's part, which then corresponds to the patient actually responding to our treatment recommendations.
I mean, it really plays out like the better your communication skills are, the more rewarding and more positive your interactions are with your clients. And the better the information that gets exchanged. So you can almost think of it as like the truer the information. So you get a better idea of what is actually going on. You form this really great rapport with a client that allows you to meet them where they're at and provide treatment options that fit within their specific goals and their, the context of what they're working with. So I think I feel like the more comfortable I got with the communication with clients, the more comfortable I was with using these skills. I just got better quality of information, often in less time, with less, with one or two questions, I can get a ton of really good, useful information that gives me context, and so that I can meet the person where they are. Like, I can treat them with respect, treat the information they have with respect, where they're coming from, meet them there so that we can work together to provide the best care for that animal. Because, I get an idea of who they are, where they're coming from, what context they're working in, what context the animal is living in. And then we come up with a plan together, because it's a collaborative plan, there's automatic buy-in from both sides, right? It's a plan that we both agree on. So the likelihood of the client following through with the plan goes up because they're part of that process. They're deeply involved and engaged in that discussion. So I feel like I get better. I feel like almost every interaction is a positive interaction because the client and I, come up with a plan together that works for everyone involved. So I don't think of it as like my agenda, their agenda. It's like, what's our agenda and our goals? So each interaction is positive. Even if that interaction ends up with euthanasia, it's still positive because it's a decision we came to together through conversation.
That makes sense. And then if I think of you said, euthanasia ends up being a positive situation because it's a collaborative decision that we've made together. I think of the way just framing that and having that experience as a collaborative, positive one impacts the mental health of the individual veterinarian. As you're going through euthanasia appointments, it's not always sad. It can be very relieving in a sense.
Yeah, definitely.
Yeah, you read my mind, Jasmine. Actually, we're in a bit of a crisis right now as a profession in terms of our well-being and our commitment to staying with the profession. And I think these skills are really integral to being able to thrive in veterinary practice. And when I say veterinary practice, all scenarios, so whether you're in clinical practice or regulatory medicine or government, whatever path you choose, you're going to be communicating with people, and communicating with people is stressful. It just is. And having a toolbox to help you navigate those conversations is going to be really important to thriving.
Yeah.
And then, as I said earlier, the workplace culture that we create, creating a workplace that you really look forward to going to in the morning because it's a great culture and a great environment and people are interacting well with each other. When there's a conflict, people talk through it. There's a lot of dysfunctional culture, toxic environments that happen as a result of poor communication.
Mm-hmm. Yeah.
True, yeah. But when you learn in communication, they're not just client communication skills. They're so important to really every aspect of your life. Your interaction with your coworkers, your interaction with your partner, your parents, all of those skills can help you lead a richer life. And yeah, like if you enjoy, the average veterinarian does like 100,000, I think, right? 100,000 client interactions in their career. So just think if you can make those enjoyable and use great communication skills to make that a positive interaction, then that's 100,000, positive experiences you have in your career.
Yeah. Especially if we can get that buy-in with clients, because then that's 100,000 lives that we've changed and touched at the same time. If we can get it down to that four-legged creature on the end of the leash. Well, I mean, they're not always on a leash. Sometimes they're in a box. You know,
Great point.
we get to our exotics.
Yeah. That's true. Yeah, my patients never came in on a leash.
So we mentioned a couple of times about having these skills in a toolbox. I guess, what are your top 3 to 5 most important skills, and why they're important?
You want to go first, Jane?
Go ahead. I've been going first. You take a turn now.
I guess my top 3. I feel like empathy is one of the skills that's most important, and that's I think how we meet the client where they are. Right. And I don't think any of us became veterinarians because we wanted to talk to people about their feelings, or I'm not sure many of us did, but it's such an important part of what we do and allows us to meet the clients where they are and build a really positive rapport with them. So that's probably the skill that I think is just so helpful, just to recognize that we're human. We have emotions. Our clients have emotions, our coworkers, our team has emotions. So if we can open ourselves to exploring that, if we recognize that our clients are people, we're people, we have emotions, we can meet them where they are. We're not trying to convince them of anything, where it just becomes such a great collaborative relationship and builds such great rapport that it allows each interaction to be positive, or as positive as possible. So that's one of mine. I mean, I feel like open-ended questions are how we get there, like just asking people that, how do you feel? Like, it's such a great question to ask somebody, and often unexpected, but gets you so much information about, to again, meet that client where they are, and then to provide really the best care that we can for that person and that animal on that day. So those are mine, And then I think you need to pause and give space.
And I think you may have slipped in a fourth one there, because I heard collaboration and collaborative plans.
I mean, we're moving towards relationship-centered care. It's all about the relationship we form. And as Jane mentioned, it's so important for our feeling of fulfillment and filling our compassion cup instead of fatiguing our compassion cup when we're able to do that.
I would say my favorite, it's like you're asking me to choose my favorite child, Jasmine. So it's a hard one. The process of agenda setting would be one of the ones that I'd have to pull out, because I really think it's transformative when the client has an opportunity to tell us everything that they would like us to do for them today. And then I think it just makes our jobs easier, because we know what they want us to do. We get it done, or if we can't get it done, we negotiate another way to get it done, and we can either meet their needs. And so that is, really made up of the open-ended questions that Jamie already mentioned. And then the second skill there is summary. So being able to take that list from the clients and make sure they accept it back, and that they know that we've heard and we have an accurate and thorough, complete list of their needs. The second one I would say would be chunk and check. And so when we're giving an explanation, as a default, we tend to lecture. And it's true of a lot of professionals, right? We have a lot of information in our head. We want to give, we're passionate about that information. We want to share it with someone else, and we overload people with information. So if we can break it into small pieces, and then I call it like titration. We offer a piece of information, we check in and see how it landed with that person. Kind of goes back to the very first question you asked us, which is, what is communication? Sending that message out in the form of a chunk, checking to get feedback back to the client to see through the check how that information landed with them, and then tailoring what we say next based on the feedback that we got.
Yeah, I think that's beautifully stated, Jane, the way the sort of give and take of that inherent in communication, like the giving and receiving of of information and feedback on the information we provide. It's like you just wrote a book about this or something.
I did.
Awesome. I think those are all great. And I think that, with receiving that information and checking in, my mind automatically goes to malpractice and liability, which in our professional, we have a professionalism course at CSU, and we're going through that right now. We just had ABMA with Dr. Rebecca Stinson come in and talk to us about insurance and why we need it. But I think now, like, a lot of those situations could be avoided with communication, and a lot of those situations can be quite the headache to deal with on the back end. It would be so nice to just avoid them if we're chunking and checking and making sure we're actually getting true informed consent from our clients as we're developing these plans together.
Yeah. It's interesting, Jasmine, that 90% of complaints really boil down to communication. It's rarely a medical error made on a veterinarian's part. It's often the error in either leaving out information or confusing the client or not informing the client ahead of time of what could go wrong, or because we're so stressed that something went wrong, losing our caring and compassion because we're maybe in a more protective or defensive stance when we receive a complaint. And so, and so it really boils down to the way we communicated with the client, not necessarily what we did to the patient.
And even taking that to them when medical errors do happen, the way we communicate those medical errors makes a huge difference in how the client responds and whether we can rebuild the trust with them and keep working with them or not. Whether we are, there's some liability or complaint to the licensing board or whatever. Is very much communication related.
What would be your best advice to get over that hump of nerves and that having to tell a client, I made a mistake, my technician made a mistake, or honestly, just owning it, like our team, our hospital made a mistake. How do you get yourself there? How do you get yourself ready to do that?
Well, certainly, I think getting all your facts straight, as many as you can before you talk to the owner is helpful. But really, it just comes down to owning the mistake and apologizing with a sense of responsibility for that error that's happening, and then talking to the owners about what happened, why it happened, and how we're going to prevent it from happening in the future goes a long, long way towards rebuilding trust. And I think unfortunately, I have done that with clients. I made mistakes, which we're all going to do because we're all human. And I can say that every time the conversation was never as hard as I thought it was going to be. What was holding me back from the conversation once I started it, it was not nearly as bad as I thought. It was, I think the anticipation and the stress on my end was worse than what actually happened. So I think just being transparent and just being honest goes a long, long way towards clients. The clients recognize we're people and we're not perfect and things happen.
Yeah, what Jamie just said at the end there, I think, is what gets me over the hump, which is integrity. I know that I need to do this, and I know this is the right thing to do. And even though, and I think this is about being a healthcare professional, there's a lot of right things that we have to do as healthcare professionals that are challenging and difficult and emotional and stressful. And we just know that this is the right thing to do. This is the right thing to be honest. It's the right thing to take accountability. And it's the right thing to try to prevent it from happening again and make a plan for recourse. How are we going to make it different moving forward? And I always think of Stephen Withrow. I know you probably haven't interacted with him, Jasmine, but he is the founder of our Animal Cancer Center here. And he's also the founder of the discipline of veterinary oncology. And one of his big principles was do the right thing. And so sometimes I just thought, that gets you over it because you're like, I have to do the right thing here.
Yeah, and you feel better because you did the right thing, and it doesn't weigh on your consciousness, and and cause all that regret and anxiety and stuff because you're like, yeah, I did the right thing. So yeah, that's a great point.
So what I'm hearing is more mental health
Yeah, it
appreciation
really is.
and
Yeah.
overall taking care of yourself by doing the hard thing, but being the
Yes.
right thing at the same
Yeah.
time.
Yeah. The other phrase, we can do hard things.
We can do
Um,
hard things.
We
Yeah.
can do
That's a
hard
good
things
phrase.
in our
Yeah.
profession. In our profession, we do a lot of hard things. And there is something about who we are that we are resilient to go through those hard things and to have the courage to do those hard things.
And it makes a
Oh.
difference. I mean, it's transformative. I think like it makes a difference in you professionally, like ethically and professionally to do that. Again, I think it becomes like a positive thing where this bad thing happened and I owned it and I did the right thing and therefore becomes a positive thing.
And I think one more thing, you said, how do you get the courage? The other really important thing is that you surround yourself with support, right? So you have to have the gumption to have this conversation, right? But before the conversation, maybe even during and definitely after, right, you debrief and you pull in your support team and you talk about what it's like and you do it multiple times, likely, probably is not, you still have a lot to process. In the moment, you have a lot to process afterwards, and you probably have a lot to process even weeks to months after it happens. So pulling on your support team and making sure you surround yourself with the professional guidance that you need in terms of support and also just advice on how to handle the situation.
There's lots of people out there to help.
So being in this situation can be used as a way to help build psychological safety within the workplace, and overall you'll use the same communications skills to build a more positive workplace culture.
Exactly.
Awesome. What other resources would you recommend or out there for veterinary students as we're going through various communication programs? I know there's more schools that are starting to develop more programs, or just going through clinics and practicing some of these skills. Where can we find more information?
The first thing I would say is take your communication curriculum seriously. I know they're highly variable depending on what program you're in, but take advantage of whatever learning opportunities you have in the moment in that simulation environment or even that classroom environment and practice. And then when you're a fourth year and you're on clinics, take every single opportunity you can to communicate with clients while you're in that supportive environment with a team around you. So volunteer to say, I would love to present that diagnosis and treatment options to the client, or I'd like to perform that euthanasia procedure with you by my side and support the client in that way, or I'd like to deliver this bad news of a cancer diagnosis and like jump in head first. And then postgraduate, there's opportunities to do continuing education workshops. And there's opportunities to stay on top of the literature. There's communication publications and JAVMA and other common journals for the profession. And there's book resources. And so I just happened to just complete a book, but I have other colleagues who've written books as well. And so there's several really great book resources that you have available to you to continue to practice. And the fourth thing I would say, and Jasmine, you've experienced this yourself, I think the most powerful thing is to be coached.
Mm-hmm.
Yeah.
Because we're not always aware of what we're doing. And so to be able to put yourself in an environment where you can be coached and someone can say, hey, wow, this is your superpower. And then here's an area that you can develop and grow as a result of.
Yeah. I think it's important to remember that these are skills just like any other skill that we use as a veterinarian, suturing, venipuncture, surgery. These are skills that we can practice and keep practicing. And yeah, and I love it. Take the opportunity to practice it in a situation where you can get feedback so that you're not practicing in a vacuum, because then you don't really know what the results are. You can ask your clients, you can ask your coworkers. You can ask coaching. Yeah, if you're doing this in your school, take advantage of any coaching that you can. And I think, as Jane pointed out, just being vulnerable and saying, I want to work on this. Can someone watch me do this client communication or do this euthanasia and help me and provide feedback? Being proactive and asking for that feedback makes a huge difference in your growth.
So mentorship is a hot topic. And what I'm thinking is that, like, when we think about mentorship, is medical decisions. Like, I'm managing a case, I want my mentor by my side to go ahead and make sure I'm checking all the boxes, doing all the right things. But what I'm also hearing is that maybe there's a good portion of that conversation with that mentorship is to be our coach, if that is their role. And that's something we should definitely talk to them about beforehand.
Yeah, those are great things to set up ahead of time. Like, here are my goals for this rotation, and one of them could be a communication goal. It's not only just learning, whatever topic you're on, but my one of my goals is a communication goal. And can you help me with that? Because as mentors in the clinics, especially, we're coaching you on all sorts of things, and take that opportunity and push your coaches to give you lots of feedback.
2 things that are coming to a theater near you as you become a 4th-year student is communication rounds on community practice. So the other thing that practices can develop is doing communication rounds in practice. And so instead of talking, traditional rounds talk about the clinical reasoning and the diagnostic process and the response to treatment. This is, how did that communication go? And it can be both a celebration. Here's where our team really handled a situation really well. Let's dissect it. What did we do? Here's a place where maybe our team fell flat, which is going to happen. It's going to happen to all of us, right? And so let's reflect on it, not a finger pointing way, but in a, what could we have done to handle that differently? Mm-hmm. And the other thing that's coming to theater near you is the oncology rounds. And so on our oncology service, they round on the client interactions, but they also round on the emotion, right? So what is it like to deliver a cancer diagnosis? What is it like to lose a patient? What is it like to help a client manage through some very difficult decisions? There's often multiple choices. They're very expensive. Sometimes they're invasive. Sometimes the animal feels quite poorly, right? And so it's an opportunity to do both debriefing on the way we interact with each other as a team, or the way we work with our clients, and then how do we support each other when things get emotional. We've had maybe we've lost our favorite patient this week in our clinic. Mm-hmm. And to take a moment to go, let's not just keep working through it. Let's stop and let's acknowledge what happened, and let's talk about how everybody's doing.
Those are great. We started doing feelings rounds on the exotic service at Cornell when I was there, and they were so popular. Like, we got a little resistance when we first started being like, no, I just want to talk about how you're feeling today. But it set a culture in which everyone on the service, especially those of us that were there every day, since the students rotated through, we were all like, here's how people were just volunteer. This is how I'm feeling today. And it gave you great insight to know, like, what's going on with people.
Yeah, and my understanding is that there's even an app now for it. I think it's called a Mentimeter. I don't pitchfork me if I'm wrong. I'd have to double check that. But it's a anonymous app that you can set up with your team, and every day they click in a happy face to a frowny face and like how they're doing. And they may have the opportunity to write like, I'm feeling this way because of this. And that also gives the team a chance to be like, okay, somebody's not feeling great on the team. We don't know who it is. And it's anonymous so that people are honest, right? Let's address that in a way that is both productive and helps to get everybody at the same level. And if we can't get everybody at the same level, we can't make everybody's day a little bit more brighter, that's okay too. But at least we can acknowledge and recognize that maybe not everything is so personal today, or somebody may be taking things more personally than it really seems on the surface level to us because of the way they're feeling that day.
I've also worked with practices who do something similar, but in an in-person format. They call it a team huddle. So it doesn't have to be a long period of time. It could be 10 minutes at the beginning of every change and shift to gather the team and go, how's everybody doing today? who are we missing? What challenges are we facing? What strengths are we bringing with us today? So you kind of have a sense of how the team's coming into the work for the day.
That's so great. I mean, that really allows us to support each other so much more honestly and like pointedly. When I know what you're going through, I can offer much more specific, more helpful support than if I don't know what you're going through.
Yeah. And we can be proactive to fill in and support in the blanks, right? So if someone's out, maybe someone's out of work that day because they're sick and we're down a team member, or maybe someone's at work, but they're pretty distracted because of what's going on, right? So we can fill in some of those slots and support each other instead of just kind of muscling our way through the day.
For sure. And I love the way
back to some empathy.
Yeah. Empathy and just that positive experience in the job. And it is like a light at the end of the tunnel for this profession. I think, having these skills equipped can really make a big difference for everybody.
Agreed.
I had to ask you, Justin, what's your favorite communication skill?
My favorite communication skill. So for those of you who don't know, CSU has a very robust communications curriculum. We get different skills that we build up on. And then I guess we kind of start it in second year with the simulations, but we do it as a team. And then in third year, you're quote unquote thrown to the wolves with support. There's a leash on the wolves.
Lots of support. Yeah, lots of support.
And in those simulations, I was told that empathy was my superpower, that I'm able to really relate to the clients. And so I have to say that one is my favorite. I would say, though, the most challenging one for me is summary, and going back and listing things out, because I do like to paraphrase and I don't always get everything on the list. And I always have to go back to the agenda. Well, what else are you missing? And getting that magic, that's it, from the client. And then establishing priorities. But I do recognize how important that is to really sit down and summarize with the client so that we are meeting all of their goals today. I would be very disheartened if, and I'm sure it will happen, so I guess I should say when, a client feels like they came to me and I didn't service them in the way that they intended, or would have liked that day, that they didn't get their full value out of our visit. Because we don't get into this profession just to sling vaccines and not help people or their animals. We get into this profession to truly help them. And with the cost of care increasing the way it is, across the board, and lots of different factors go into that. We have other podcasts you can go ahead and take a listen to if you want to get into those. But I feel like as a consumer myself, I would love to know that, like, I'm paying $100 to go see for an exam fee to see this veterinarian today. I want to feel like I got $100 out of today's visit. And for some people, that varies person to person. Some people, just seeing your face and then getting that vaccine, that's worth $100 to them. But some people need a lot more. They want to talk through a lot more. And just making sure that each client feels heard is something I find very valuable and is going to be very important to me as I continue throughout my career.
I think you bring a good point, which is then when the time comes that you are interviewing for practices, to think about what's important to you about your interactions with your clients and aligning that with the culture of the clinic. Because, right, if you want to be able to have time to really meet the client's needs and hear what they have to share with you, you need to align with a clinic that's allowing you to have that time in your appointment time to be able to spend that time and to be able to invest in relationship, not just transaction.
Yeah. Mm-hmm. So that you feel successful. Yeah. Personally.
Yeah. And I think that with the other business topics that we talk about within the VBMA, if you take that time and you take care of your team and you take care of your clients, your average client transaction will go up. Because what I'm hearing is that we'll get more buy-in. We have a client, cooperative. That's what I was looking for. Cooperative plan in place to where, okay, so maybe before, if I only had 15 minutes with them, I didn't get to relay the full value of the blood work and why it matters to them. So they chose not to do the blood work. But if I had just 30 minutes, 15 extra minutes, yes, I'm seeing one less appointment, but I'm getting a higher average or a higher transaction per client at that point, to help make up for some of that difference. And I think that can make the difference for a lot of people.
That was very well stated.
Yeah, I agree.
Thank you. I learned from the best. So as we kind of wrap today's conversation up, are there any other thoughts or closing remarks anybody wants to share?
I think it's important to just remember that we're all works in progress. Like these skills some skills are going to come easily for you. And Jane calls them your superpower. Those are the things that work really well. And then some skills are going to be more challenging, and that's okay. Right. And we're not expected to be perfect. We shouldn't expect ourselves to be perfect. Just keep practicing. Like that's how we get better.
And building on what Jamie said, we're both in the same mindset, which is we're human, right? We're never going to be perfect communicators. The ceiling is so high for this skill. And so I think the most important thing is making a recovery. So that starts with self-awareness to go, oh, this didn't go as I thought it would, or the client is not responding the way I thought they might. I'm getting some sense from their nonverbals or what they're saying that they're not feeling good, or they're feeling concerned, or they're growing frustrated. And then being able to stop in a moment and go, oh, I'm sensing that we got off track. And then to ask permission, can we get back on track? And I really want to work with you to get this straight. And so to me, I think the most important thing I want to teach all of you is how to make that recovery, because we can't teach you ever. It's not realistic to think you're going to get it right. But what I think is realistic is you're going to get it wrong, and here's how to fix it.
That's great. Yeah. And it's so true. Being vulnerable with our clients and just being human with them allows them to be human with us. Like when we when we're like, I'm not perfect, and just owning that, I feel like my sort of saying is that vulnerability doesn't make you weaker. It allows other people to make you stronger, to help you be stronger.
So I like that. You should put that on a t-shirt.
And I think that brings us, Jasmine, back to our medical error comments, which is if we have the trust built before we go into an error, we have a lot of cushion when we make an error. And it doesn't have to be a medical error. It could be just, the client's scared about something or not comfortable with making the decision or going to surgery, right? If we have that trust built, then we have the cushion to be able to work through these challenging conversations, whether it's not finances or an error or delivering bad news or something doesn't go right with one of our colleagues, the interaction with one of our colleagues. That trust goes a long way because they know that we really do care and that we're compassionate and we really want to do the right thing by our patients and clients.
Yeah. And I know one of the ways, Dr. Morrisey, we kind of talked about, because we call them rewinds when we want to go back and practice something. Is it true that we can really just sit with a client and just be like, hey, can we rewind this? Can I step out of the room and come right back?
Totally.
I have done it. Yeah. I'm like, I'm sorry, that came out very poorly. Let me rewind that. And clients are like, yeah, I'd say not 90% of them don't even bat an eye. They're like, okay. Then some of them are like a little confused about it. And then when I start, they go, oh, I get what you're doing.
Yeah.
And I think, again, it just shows that we're human and it's okay not to be perfect. Like, so that the clients don't feel that they have to be the perfect pet parent or know everything or make the perfect decision. We're all just doing the best we can every day. So we model that, and their clients, they really respond to that.
Awesome. Well, thank you both so much again for being here today and for chatting with us about everything. I don't even know what to call it. Talking about life, how to navigate the world in relationships. I think overall navigating relationships is huge part of this today's discussion.
Thank you for having us. Really enjoyed it.
Yeah, thank you, Jasmine, and thank you to all your listeners.